The guidelines of Indian Medical Association makes it mandatory for all the HIV testing centers to give HIV counseling to the people before and after taking the test. But most labs and hospitals are not following these guidelines. It may be observed that HIV patients have suicidal tendencies and cases of depression are very common among them. Not getting counseling is only going to worsen their state. The patients who don't receive counseling before testing say that they feel anxious and depressed.
मुझे एक पेपर पे साइन करने को कहा था जिस पर लिखा था कि मुझे काउंसलिंग दी गई है, लेकिन टेस्ट देने से पहले ना मुझे कोई काउंसलिंग दी गई ना टेस्ट देने के बाद कोई काउंसलिंग दी गई.
An official from the lab said that they don't give counseling because according to them, patients don't want it. According to an official at KSAPS, out of all the hospitals and labs in Karnataka, only around 220 are under the purview of KSAPS. The rest don't give HIV counseling.
As per the NACO guidelines, National AIDS Control Organization guidelines, again we say it is supposed to be a mandatory before doing any test. Those hospitals who are not under our purview, then they do it directly without any counseling. This is not acceptable at all. But again, they have to follow some sort of guidelines which is again agreed upon by National AIDS Control Organization and Government of India.
Doctors say that pre and post-test counseling for HIV is extremely important.
People who don't offer counseling before testing, then there is a state of shock to the patients. There is a state of denial. The patients may end up in suicides and the families will be shattered.
An HIV counselor at KSAPS says,
ಕೌನ್ಸಿಲಿಂಗ್ ಅತಿ ಪ್ರಾಮುಖ್ಯತೆಯನ್ನು ಪಡೆದುಕೊಂಡಿದೆ. ಯಾಕಂದರೆ ನೆಗೆಟಿವ್ ಇದ್ರೂ ಕೂಡ ಅದು ಪ್ರಾಮುಖ್ಯತೆಯನ್ನು ಹೊಂದಿರುತ್ತೆ. ನೆಗೆಟಿವ್ ಇದ್ದರೆ ಅವ್ರ ಕೇಸಲ್ಲಿ ವಿಂಡೋ ಪೀರಿಯಡ್ ಇರ್ಬೋದು, ಆಗ 3 months ಬಿಟ್ಟು ಅಗೇನ್ ಟೆಸ್ಟ್ ಮಾಡಿಸ್ಕೋಬೇಕು. ಅದೇ ರೀತಿ ಪಾಸಿಟಿವ್ ಬಂದರೆ ಅವ್ರು ಯಾವ ರೀತಿ ಟ್ರೀಟ್ಮೆಂಟ್ ತೊಗೊಳ್ಬೇಕು, ಆಮೇಲೆ ಅವ್ರು ಯಾವ ರೀತಿ ಲೈಫ್ ಚೇಂಜ್ ಮಾಡ್ಕೋಬೇಕು, ಕೆಲವರು ಸುಸೈಡಲ್ ಟೆಂಡೆನ್ಸಿ ಇರುತ್ತೆ.
HIV counseling is so important. NACO and Indian Medical Association should take care that their guidelines are actually followed all over the country. From Bangalore, Hardik Anand for CityCast.